In this session, I'm going to talk about infertility, the various reasons for infertility, and also different methods that are available to overcome infertility. Let's see, infertility. Now, first look at the definition. It is inability to produce children in spite of unprotected sexual cohabitation, right? So now it's the male and female partner, the wife and husband living together, and without using any contraceptive methods, so which I call here unprotected. So without any contraceptives, okay, if they are in a sexual cohabitation and yet they are not able to produce children, then the condition we call infertility. Now, out of the two partners, whom to be blamed for infertility? Now, in a country like in India, it is the women that are mostly they get this blame, that if anyway in a family if there is no children, then it is the woman who will be blamed for this infertility. But the point here is the infertility problem may lie in the female partner, or it may lie even in male partner, or in some cases the problem may lie in both the partners. So that will be decided once both the husband and wife, or the male and female partners visit a doctor, and after tests, right, it is the doctor that confirms what is actually the situation, and according to that there may be different methods available on which the partners can choose, and finally can have children. Now, as I said, infertility has some reasons. Now let's look at uh, the reasons for infertility. So these reasons are actually many. I will be talking mostly few of these reasons. So here there are some physical reasons for infertility. Then another one called congenital. So we have congenital reasons. Then there are certain diseases responsible for infertility. Then we have drugs. Then we have immunological conditions that can also cause infertility. And then there may be even psychological, etc. Now, coming to the physical reasons, like in this case, the physical reasons may include formation of a cyst in the ovary. So formation of cyst in ovary, and if that is the case, it can result in ovulation disorder. So there may be no proper ovulation if cyst exists in the ovary. So that is one physical reason here. And there may be uh, blockage or damage to fallopian tube, right? And in the same way, in case of males, the blockage or damage to vas deferens, and so right. So there are reasons both in male as well as females. So here I just mentioned two cases in case of right, female. So these are the physical reasons for infertility. Now congenital, which means these are some kind of disorders that come by birth. So whatever that disorders that come by birth, we call them congenital. Okay, now I said there are some diseases, and already in the previous session I told, when I am discussing sexually transmitted infections, that certain STIs can also cause infertility. So, right, the sexually transmitted infections can be the one reason here, and in that we also have seen about PIDs. Okay, so which are called pelvic inflammatory diseases. So these are, okay, some kind of diseases which will be also responsible for infertility. Now the drugs, maybe medications or narcotic drugs, can also cause both. Okay, the narcotic usage of these narcotic drugs like heroin, opium, and so right, that, and also some medications for a very long time, or the medications that have very adverse effects, they can also cause, okay, infertility condition. Now coming to immunological, in immunological, okay, there are certain conditions like autoimmune disorders. So autoimmune disorders are conditions where usually an antibody produced in a person will protect that person, but in certain conditions. So how it protects, actually by attacking any, okay, foreign substance if it enters into his body. But in certain conditions, his own antibodies will fight with his own body cells. Okay, and if it is the case, then the condition becomes autoimmune disorder. We'll talk about these autoimmune disorders in a chapter, human health and diseases. Okay, now, so that is one reason, okay, for having infertility here. Now coming to this, right, psychological, this psychological disorders will include like uh, fear of losing, okay, her life, or right, baby's life during delivery. So there are some women, okay, who have anxiety and think a lot about, okay, as the delivery times are very crucial, and okay, so they may feel that they are going to lose their life during the delivery time, or they may lose the baby's life and start thinking, okay, about too much, and so, and that may be also one reason, okay, for these abortions and so, and can cause infertility here. Okay, and another one like impotence in erection. Okay, so here the right penis should be in erected position for the process of insemination to take place. Okay, but if it fails, then what we call the condition impotency. Okay, now these are few reasons, right, that are actually responsible for infertility. Now let's see, okay, the methods to overcome infertility. Right, now there are a lot many fertility clinics. Okay, so these fertility clinics actually help in diagnosis, and okay, they also give corrective treatment. Now, in some cases, these corrections, if not possible, then the couple are assisted with certain special technologies that are commonly called assisted reproductive technologies. Now, okay, let's look at those special techniques called assisted reproductive technologies. In short, I call it ART, so which means assisted reproductive technologies. So these assisted reproductive technologies will include, okay, IVF ET. So this stands for in vitro fertilization and embryo transfer, right? And another one called gift. So this one stands for gamete intrafallopian transfer, right? Then another one, ICSI. So this stands for, okay, intracytoplasmic sperm injection is another method, okay. We use the last one I'm going to discuss will be AI. It's a artificial insemination, right? Okay, so these are all different assisted reproductive technologies. IVF ET, which stands for in vitro fertilization and embryo transfer. Then gift, okay, gamete intrafallopian transfer. Then ICSI, that stands for intracytoplasmic sperm injection. And lastly, artificial insemination, that is AI. Now I will discuss all these methods in detail. Right, now let's see the first method, IVF ET. So where I already mentioned in vitro fertilization and embryo transfer. Okay, so here the meaning of this in vitro fertilization is fusion of gametes that take place outside the female. So already we know, we studied in the previous chapter, the fertilization takes place inside the female body, okay, in the fallopian tube, right? Now if it is the case, if the fertilization where the egg and sperm meet inside the female, okay, body, then the condition is called in vivo. Okay, so if naturally, so in vivo is a natural, okay, process where the fertilization takes place in the fallopian tube. If the male gamete and female gamete are fused, okay, in artificial conditions outside in a laboratory, then the condition is called in vitro. Okay, so we are going to perform a in vitro fertilization. Okay, so for that reason this has a name, right, in vitro fertilization. And embryo transfer, we'll talk about that embryo transfer, what actually it is. Now this IVF ET is popularly known as test tube, okay, baby program, right? So here, as I use the word test tube, many are of idea that test tube baby means the baby will be developing the test tube, or okay, actually that is not the case. So what happens in the test tube is only the fusion of male and female gametes will take place, and the rest of the development will take place normally inside the, okay, mother or the female. Okay, so it's commonly called test tube baby program. Now what we are going to do in this okay, technique, that is assisted reproductive technology. Now we are going to collect ova. So the ova means eggs are collected from a donor or collected from a donor or a, okay, or the wife or the partner, the female partner here, okay. And then the sperms will be collected from again a donor or from the husband, okay. Now the chosen egg and the sperms will be allowed to, okay, fertilize, okay, or the chosen sperms will be allowed to fertilize these eggs, okay, in a stimulated conditions in laboratory, okay. So fertilization is performed in a stimulated conditions in the laboratory, okay, right. Even eggs will be chosen and some sperms will be also chosen, so which will be the best one, okay. And then they will be, right, allowing them to, right, naturally the sperms to fertilize the eggs here. So okay, you can see, right, so this is an egg and right, sperms, okay, right. And this process actually takes place in a test tube, okay. So once the fertilization takes place, it results in the formation of a zygote and embryo, okay. So after fertilization, we know it results in the formation of a zygote, and if the zygote starts dividing, it results in the formation of cells, what we call them blastomeres, okay. And that may develop into, right, embryo. Now here, depending on whether we are going to, okay, introduce the zygote or embryo with certain blastomeres, okay, lesser, and if there are more than certain okay, number, basing on that we have two different types of this IVF ET. So the zygote or early embryos, okay, thus formed, right, they will be now transferred to fallopian tube, right. Now as I told that IVF, basing on the condition, it is of right, two types. Now let's say IVF ET, okay, so I'll call it one as a GIF, okay. So this stands for zygote intrafallopian transfer. It's called zygote intrafallopian transfer. And another one called IUT. This stands for intrauterine transfer. Okay. Now let's see what we will do in ZIFT. So here in ZIFT, either the zygote or embryo with up to 8 blastomeres, okay. So embryo with up to 8 blastomeres or zygote will be transferred, okay, into the fallopian tube, okay, right. So in this case, so these will be, okay, transferred into the fallopian tube, okay. So if the condition is it is still zygote or it started to divide and resulted in the formation of an embryo with 8 blastomeres, then we are going to transfer it into the fallopian tube, okay. Now if embryo with more than 8 blastomeres, So if the embryo is with more than 8 blastomeres, then okay, these or this embryo is transferred into the uterus. Okay, so for here I may mention transfer to fallopian tube or into the uterus. Okay, right. So here the IUT, intrauterine transfer, which means the embryos that have more than 8 blastomeres will be transferred into the uterus. Okay, so that's the IUT. So as I said, IVF, ET, depending on the condition. Okay, if the embryo or the zygote, okay, if the zygotic condition or embryo with the 8 blastomeres, they will transfer it into the fallopian tube. And if this embryo exceeds 8 blastomeres, then they transfer into the uterus. Now here even embryos formed, okay, so those embryos which are formed by in vivo fertilization. I told that in vivo fertilization is the one that takes place, okay, inside the female body. So in vivo fertilization is fusion of gametes, okay, that take place inside the female. Okay, so embryos formed by in vivo fertilization also, they can be removed from the female and can be transferred it into another female. So these are also, okay, can also be used for such transfers. Okay, right. So either that is GIFT or IUT. For that purposes, you can also use, okay, those embryos that have been formed by in vivo fertilization. Here, the first test tube baby born, the first test tube baby in the world. Okay, so this first test tube baby in the world is named, okay, Louise Joy Brown. Okay, and she is the one first test tube baby in the world, and was born on, okay, 12 July 1978. Okay, now the first test tube baby in India and the second test tube baby in the world. Okay, so first test tube, okay, baby in India and the second test tube baby in the world. Okay, so her name is Kanupriya Agarwal alias Durga. Okay, right, and she was born on 3rd October 1978. Okay, this is information on IVF ET, which is a art assisted reproductive technology and helps, okay, the couple to have children in either of these, okay, GIFT or IUT techniques. The next one we'll talk about, okay, GIFT, and we know it stands for gamete intrafallopian transfer. Okay, now how this method is performed, let's see. Now in this technique, okay, they are going to collect ova from a donor. Okay, so ova is collected from a donor. So that ova collected from a donor, that is transferred into the fallopian tube. Okay, into the fallopian tube of a or of another woman, okay, who cannot produce ovum. Okay, so a woman, she is not able to produce the egg. There is no ovulation, but yet even though there is no ovulation, her uterus, everything are normal. So she can go with the pregnancy normally except for the ovulation. Now in that conditions, okay, they are going to collect ova from a donor, okay, and that will be transferred into the fallopian tube of the woman who cannot produce the ovum, okay, but she can provide the environment. Okay, she has that environment, right, can provide, I mean, a suitable environment for, okay, the fertilization and even further development. So she can carry the young one, okay, in her womb. So if fertilization, except that ovulation, okay, the egg will be not of her. So the egg will be collected from someone else, okay, and will be transferred into the fallopian tube of a woman who actually cannot produce that egg, okay, and fertilization takes place normally, okay, and implantation and further development of the, okay, the pregnancy completely will be normal, okay. Now this is what we call GIFT. So this GIFT. So this GIFT will be used when the person is not able to produce ovum of her own, okay. Next one is ICSI, okay. This stands for intracytoplasmic sperm injection, okay. Now such methods usually we perform, right, when the egg wall, okay. So the egg wall here is the zona pellucida, okay, becomes hard. So the hardening of zona pellucida can take place basing on the age, okay. So if it is the case, then the sperms will be directly injected into the cytoplasm of the ovum, okay. So now this is also performed in the laboratory. So here is the ovum, and with the help of a right needle, right, they are going to inject, okay. So with the needle, a single live sperm is injected into the cytoplasm of ovum, okay. So directly, so in this case there is no okay, of the reactions, acrosome reaction. So there is no acrosome reaction take place as it will take place in the natural conditions. Here there is no acrosome reaction. Okay, directly the sperm will be injected into the cytoplasm of the ovum and thereby right, fertilizing the egg, right. And this is the method what we call ICSI. So once the zygote is formed, the zygote may be introduced back into the fallopian tube, or depending on the condition they may even introduce into the uterus. First one among these art techniques is artificial insemination. So AI, that stands for artificial insemination. Okay, now we know the natural insemination takes place through the male reproductive structure called penis. Okay, if other than that, if the insemination is done, then those are called artificial techniques, or okay, that called artificial inseminations. Okay, now here, other than the male reproductive organ, if the deposition of the sperms into the vagina takes place or done, then we have to call such procedures as artificial inseminations. Now, when we perform this artificial insemination, so this is performed in the following conditions. Right. One, when the male partner has an inability. So the inability of male partner to inseminate the female. I told already in the natural conditions, through the male reproductive organ, the insemination takes place. If the male partner is unable to do it, then right, they artificially transfer the sperm from the male partner to the female. So this is one condition under which this artificial insemination is done. Or there is low sperm count in ejaculation. So if there is a low sperm count in ejaculation, or if the male partner is unable to inseminate, then this procedure, artificial insemination, is performed here. Now let's see how this is performed. The sperm collected from a healthy donor. The sperm collected from a healthy donor, right, is artificially inseminated into the vagina. So into the vagina of the female here. Now or one can introduce these sperms directly into the uterus. So this is one way, depositing the sperms in the vagina. In another way, sperms are introduced into the uterus. If the sperms are directly introduced into the uterus, then in this case the condition becomes intrauterine insemination. So in short, I call IUI. Not to be confused with IUT, intrauterine transfer, that we have seen in IVF-ET, that is different, and IUI is different. Intrauterine insemination. So this is a word we use when the sperms are directly introduced into the uterus. In the natural conditions, it is the male partner with the reproductive organ, the penis directly, will be inseminated into the, insemination or the release of the sperms will be taking place, will take place in the vagina. That is a natural process. Okay. Other than that, okay, any other technique we use to transfer the sperms, we have to call all those as artificial inseminating techniques. Okay, so this is one method, right, that will help in, okay, overcoming the problem of infertility.